Welcome to Nursing Simplified, the smart way to survive nursing school. Do you find those delegation NCLEX style questions difficult? Do you want an easy way to remember who to delegate to and when? Well, then stick around because in today's episode, we are going to fix all of that by continuing our series on delegation with the easiest ways to remember the correct way to answer all of those delegation questions. I would love for you to stick around for future videos. So take a moment to like this video, hit that subscribe button, and turn on notifications so you always know when I upload a new video. And now that we have that out of the way, let's dive in. So, what is delegation? Well, you may think that I'm being silly defining it, but I want you to hear what it really means. Delegation is transferring a task to another member of the healthcare team while still being accountable for the outcome. So, transferring a task while still being accountable for the outcome. And if you're confused about the difference between responsibility and accountability, check out my video on this topic. Sometimes this is why delegation questions trip students up. You need to remember that you are accountable for the outcome. So you need to make the best choices in who you trust to complete a task. Because if it gets done incorrectly or doesn't get done at all, guess who's going to be held accountable? You. Now, delegation is primarily a task for the registered nurse. So, who can an RN delegate to? Well, the RN can delegate to an LPN, assistive personnel, and even another RN. It all depends on the situation and the task. So, who we delegate to is based on a few different factors. The first thing that I want you to remember is that there are certain tasks that only an RN can perform, and we use the acronym TAPE to remember what these tasks are. TAPE stands for teaching, assessing, planning, and evaluation. More on that in a minute. And the second part of this is what we call the 5 rights of delegation. If you like acronyms, you can remember the phrase, please tell dad, cats can skateboard everywhere. Remember this little fella, and we'll talk a little bit about each one. Okay, but what does any of this have to do with delegation? Well, the sentence, please tell dad, cats can skateboard everywhere. Each letter stands for one of our 5 rights. The P in please stands for person. The T in tell stands for task. The D and the C in dad and cats stands for direction and communication. The C in can stands for circumstance. And the S and the E in skateboard everywhere stands for supervision and evaluation. So let's break each one of these down just a little further. So first we have to make sure we're delegating to the right person. Is this task within the person's scope of practice? And if it is, are they competent to perform the task? In NCLEX questions, this usually has to do with the person's experience in the area under which the task falls. Next, we need to ask ourselves, is this the right task? Is the task itself appropriate to delegate? If we're delegating to an LPN or assistive personnel, we need to ask ourselves if this is a task that only the RN should perform. And how do we know? Well, now is when we think back and we think about TAPE: teaching, assessing, planning, and evaluating. And if the task requires any of these, then only an RN can perform the task. So if it requires TAPE, don't delegate. Right direction and right communication is next. So, are you, as the person who is delegating the task, giving clear direction? Does the person to whom you are delegating know how the task is to be performed, what the expected outcome is, what should be reported to you, and what is the time frame in which the task needs to be completed? Next, we ask ourselves if this task is being delegated under the right circumstance. And the big thing here is asking, is this a stable patient with an expected outcome? We never delegate tasks on unstable patients. We want to keep those patients for ourselves. The final right of delegation is ensuring you follow up by supervising and evaluating the outcome. Was the task completed correctly and on time? How did the way the task was completed affect the patient? Did they have a good outcome? And remember, you are accountable for the outcome of the task. Okay, let's try some questions. You are assigned to provide nursing care for a patient receiving mechanical ventilation. Which action should you delegate to an experienced nursing assistant? Well, firstly, we're talking about a nursing assistant. So we can probably use tape to answer that question. So let's try that. Let's go through each of the options and see if we can figure out which is best. A. Assessing the patient's respiratory status every 4 hours. Well, immediately I see the word assessing. And remember, the A in tape stands for assess. So only an RN can complete this task. We can eliminate this answer. Option B, taking vital signs and pulse oximetry readings every 4 hours. Okay, so this task is about vital signs and it is appropriate for assistive personnel. So we'll save this one with a question mark. Option C, checking the ventilator settings to make sure they are as prescribed. There are a few things wrong with this one. Firstly, we don't have the right person for the task. Checking ventilator settings would be up to the nurse or the respiratory therapist. The second part is that it states checking as prescribed. Assistive personnel typically are not interpreting physicians' orders. Instead, they're performing appropriate interventions that have been developed in the nursing care plan and delegated to them. And for those reasons, we can rule this one out. Option D, observing whether the patient's tube needs suctioning every 2 hours. Now, they're trying to get a little tricky, but don't let them fool you. They use the word observing instead of assessing. In reality, we are assessing the tube to determine if intervention is necessary. And for that reason, we have to leave this one up to an RN. So our correct answer is B, taking vital signs and pulse oximetry readings every 4 hours. Okay, next question. The charge nurse is making assignments for the next shift. Which patient should be assigned to the fairly new registered nurse with 6 months experience, pulled from the maternity unit to the medical unit? So firstly, think about who we're delegating to. This is an RN delegating to another RN, so we won't be able to use tape here. Instead, we will determine the correct answer by using the 5 rights of delegation. Option A, a 58-year-old on airborne precautions for tuberculosis. Okay, so this is a new nurse with 6 months of experience who has been working in the maternity unit. She's used to taking care of mamas and babies. and it's not likely that she's ever worked with a patient with tuberculosis. So she's not the right person, nor does she have the right experience to care for this patient. In addition, if she doesn't have the knowledge on how to protect herself, then there's a possibility she will be exposed and then return to her usual maternity unit, where she'd be working with newborns with immature immune systems. Therefore, this is not the right circumstance either. We can eliminate this answer. Option B. A 68-year-old just returned from bronchoscopy and biopsy. I don't think this nurse has the right experience to take care of this patient. This patient will require special care and assessment. We can pretty much immediately exclude this as a possible answer. Option C. A 72-year-old who needs teaching about the use of incentive spirometry. In this case, she meets the criteria to care for this patient. She's the right person because this is within her scope of practice. She has the right experience because she's taken care of mamas who've had cesarean section births. So she knows quite a bit about teaching the use of incentive spirometry. So we'll mark this one with a question mark until we review the last option. Option D. A 69-year-old with COPD who is ventilator dependent. Well, right off the bat, it's unlikely that she's ever had to care for a patient on a ventilator. Even if one of her mamas or babies needed ventilator support, they would have been transferred. Mom would have gone to an ICU environment, and baby would have gone to a NICU. She does not have the right experience to care for a patient on a ventilator, so we can exclude this option. So that leaves us with option C, the 72-year-old who needs teaching about the use of incentive spirometry. Not only is she the right person, but she has experience with this type of teaching. So this is the patient we will assign to her. Okay, last question. The patient with COPD has a nursing diagnosis of ineffective breathing pattern. Which is an appropriate action to delegate to the experienced LPN under your supervision? So here we can start with TAPE because this is an RN delegating to an LPN. Let's look at our options. Option A, assist the patient with basic activities of daily living. Well, performing ADLs is certainly within the scope of practice for RNs, LPNs, and assistive personnel. So we'll put a question mark here as a possibility. Option B, plan a nursing care regimen that gradually increases activity and tolerance. Well, right away we see the word planning, and care planning can only be performed by the RN, so we can immediately exclude this one. Option C, reinforce teaching regarding pursed lip breathing. Okay, so here we see the word teaching, but don't jump the gun here. Remember, the RN must do the initial teaching, but an LPN can reinforce teaching. So we'll place a question mark here and move on. Option D, consult with the physical therapy department about reconditioning exercises. So this one can be a little tricky, but let's work through it. Remember, you may not actually see the words teaching, assessing, planning, or evaluation in the question. The tricky word here is consult, but what does that really mean? Well, let's think about it. Why would a nurse be consulting with another member of the team? It would be to plan care for this patient. The nurse is collaborating with another discipline, so their recommendations can be considered while developing the care plan. So, for that reason, we will exclude this answer. But now we're left with two possibilities: assisting with ADLs and reinforcing teaching. So, what we need to look at is how best to utilize the skills of this nurse. So, we can go back to the 5 rights. Let's take the 2 skills and see which one this nurse is best suited for. ADLs. If we assign this nurse to the patient needing assistance with ADLs, would that make better use of her skills? Or would having this nurse reinforce teaching make the best use of her skills? We have assistive personnel that can help with ADLs, but they're not able to reinforce teaching. So it would be best to assign the ADL patient to the assistive personnel so we can maximize the skills of the LPN. And for that reason, C, reinforcing teaching regarding pursed lip breathing would be the best choice for this as the correct answer. So we will mark C as the correct answer. And there you have it. Today we talked about delegation. You learned how to delegate, who to delegate to, and when to delegate. So congratulations. You are going to skate through all those delegation questions. If you enjoyed this video or you learned something, please take a moment to click that like button now. This helps other nurses and students like yourself find our videos. And don't forget to subscribe to our channel and hit the notification bell because you don't want to miss what's coming next. I hope this video helped you gain knowledge and confidence. But if you're ever feeling discouraged, I want you to remember, you are beautiful, you are needed, you are loved, you are strong, and most of all, dear friends, you are enough. Now go out there and be the amazing nurse you were meant to be. And remember, nursing is a work of heart. See you in the next video.